Hi guys, I'm Jade Campbell, qualified dental hygiene therapist. Today I'm going to talk about floss. The reason this is important is because brushing only cleans 60% of your mouth, so we need to clean the other 40%. This is important because we want to prevent tooth decay forming between the teeth and gum disease. So there's two types of floss that you can use, floss on a stick like this, or floss that comes on a string. I prefer the flat ribbon type compared to the string type, but it is your personal preference. I say find a brand that you like and stick with it. There's a lot of rubbish ones out there that fray and break, so just try a few until you get one that you like. Otherwise you're likely to give up. The other thing I say is if it's out of sight, it's out of mind. Alright, so I put my floss in a jar like this and I keep it beside my bed so it reminds me I need to floss, and then that way I form a habit of doing it every day. Some of my other patients have made bookmarks, stuck it on the mirror just so they remember to do it. Okay, so you also might notice with flossing that you get bleeding. Don't be alarmed, okay? This is actually a sign that you need to floss more regularly. It's because the immune system is trying to deal with the problem by sending that sort of blood and inflammation to the gums. So if you floss regularly, you should start to see this decline within about 10 days, okay? And then you know you're doing a good job, but don't stop. Right, so I will start with this floss here, okay? So with all kinds of floss, the technique is the same. What you want to do is pop it in between the tooth, down close to the gum and push it slightly under. You don't need to force it down, it will just stop naturally. Then I say cuddle the tooth and bring it up, so you scrape the bacteria away from the gums. Then you want to go back in, tight against the other tooth and scrape up again, okay? If you've got tight teeth, like I do, little tip, these are really good. If you pop it there and then just bite onto it, that will force it down, because I know some of us struggle getting the floss down. With your tape floss, get yourself a nice generous amount because you can use this as you go around the mouth, okay? So I tend to knot it at one end so that I create like a loop so I can keep going round. So nice and simple, just pop a little knot in there, okay? Like that. So as you floss, you can then go on to the next bit like that, okay? So I say wrap it around your fingers and then use your thumbs to manipulate, okay? Now, it's hard to hold the model at the same time, so I'm going to do it on myself. So, hold it up, underneath the gun, tight and scrape down. Then you want to do exactly the same gap, but on the other surface. Up, tight and scrape down. As easy as that. It's a bit fiddly when you're not used to it, but give it a couple of weeks and you'll pick that up really quick. Alright guys, if I can help with any other videos or you'd like any more detail on that, please let me know in the comments below. Thank you.